And we're also joined by Jeremy Stein with Connecticut Against Gun Violence. And, of course, the usual cast with Paul and Josh. Paul. So, once again, TV stations will be getting started in 1 minute. TV stations will be getting started in 1 minute. Thirty seconds. 30 seconds. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody. Hope you had a great weekend. Here with Josh and Paul, of course, and a few friends I will introduce you to in just 3 minutes. First of all, what's happened with COVID over the last few days since Friday? Essentially, I think very positive trends continue. Positivity rate below 2%, 1.8%. 7-day average below 2%. First time that has happened in over 6 months. Current hospitalizations, 41. Lowest hospitalizations we've had, I think, in about 6 months as well. Fatalities, 15, about 5 a day. So ever since we moved to 100% occupancy 3-4 weeks ago, I think that is working out okay. Our numbers continue in the right direction. As you know, on Saturday, we allowed outdoors. We allowed to have a drink without a meal. And some of those trends, I hope, have been reinforced by the good news. Thanks to each and every one of you that we are making progress. We're making progress because of vaccine update. I just want to give a little shout out to the people at Connecticut, our healthcare providers, our federally qualified health centers, CVSs, the hospitals, the mass vaccination centers, in each and every one of you, making an enormous difference. We're the first state in the country to have over half of our adults fully vaccinated. That's an extraordinary achievement that allows the reopening to continue in a prudent way. It makes such a big difference. 69% of our folks have had their first dose. That's good, but as you can tell, it's not going up as quickly any longer. So we still talk a little bit about incentives and way you can get your friends and friends of friends to get vaccinated and keep that going, because that's how we break the back of COVID. So what we are doing is reinforcing our messaging. That's the $13 million of the federal support that's going to go out to messaging, going out to door knocking, going out to telephone calls, working with our amazing local public health departments and community support groups, making an extra effort right now to do everything we can to convince those that are maybe a little hesitant, holding off, invincible, don't think they have to get vaccinated. This is the time to do it. But congratulations, Connecticut. First in the country to get over half vaccinated. I think you remember from a couple of weeks ago, you saw what an enormous difference that benchmark made in Israel going back a few weeks, and I think you're seeing the same difference in a positive way here in Connecticut. So a little shout out just in terms of how our different towns and regions are doing. I think you can see up there in northwest Connecticut, you've got Canaan, you got Salisbury. They've been sort of our champs. 76% of the people have had their first dose. That's remarkable. Down along the shore there a bit, you've got Old Saybrook, you've got Lyme. So extraordinary positive there. And but it only works if not only you get vaccinated, but the towns next to you and around you get vaccinated as well. If it spreads over there, nothing keeps us totally safe. So we got to keep darkening that map, and you can see where we have some progress still to make. Most first doses, might as well say it. Stanford is our champ, but 66,000. Well done. New Haven, Bridgeport. So we've got a way to go there, but we are making extraordinary progress, and we need your help on that. While I'm doing lists, I'll point out I just saw that Secretary of State Merrill had her list of the Democracy Cup, those places that were most likely to vote. The only commonality on there for big cities was Stanford. They had 80% of their folks voted, and they're the champ when it comes to getting first doses for big cities. Burlington and Newtown were the smaller towns, mid-sized towns that led in terms of democracy voting. Anyway, it's good to have a little healthy competition, but most importantly, I want everybody vaccinated. If we're making real progress when it comes to our physical health, real progress when it comes to keeping people out of the hospital, keeping people out of the ICU, reducing fatalities in a dramatic way, we still do have some healing to do. And a lot of that is related to mental health. And here I'd just like to take a few minutes because there we still do have some work to do. And maybe it's a little bit like when people see a light at the end of the tunnel. Maybe it's a little bit like being in the holiday season, but a lot of the calls to 211 are spiking right now. And you're also seeing that related in some crime-related statistics as well. So first, let's just talk about the mental health. And I've got a friend I'm going to introduce. The 211 hotline is there. People are calling, and we respond through some amazing partners. And they respond by phone, they respond by telehealth and virtual recovery supports. We also have, I think it's 18 mobile recovery vans, so we can go right to your place of need, depending on what the need may be. And these mental health professionals, these social workers are there often alongside our amazing police. You know, in the old days, we sent the police to every type of emergency. It may have been addiction. It may have been domestic. It may have been, just real mental depression. And but if there was a potential for violence, the police were there. But often you need other professionals along the way, the social workers, to do what they can to help. One of them is Kim Beauregard. Kim is the CEO of Intercommunity in East Hartford. She's been taking the lead on behalf of folks in her greater community for many, many years now. And Kim, just tell us a little bit about what you see and what we should do.
Unmute. There we go.
Thank you, Governor, so much for having me. Yes, we certainly know what we've all been through in the past 14 months. It has swept our country and the world. And now as we're kind of coming out of it, 14 months into this and kind of seeing, maybe a little light at the end of the tunnel with this great news of all the statistics, we really need to start focusing on people's mental health and substance abuse issues that really have just been astronomical through this whole COVID pandemic. People are stressed, they're tired. Many people, especially people of color, have seen their friends and family die. And so many changes have happened in our work lives, our school lives with our children. And we cannot underestimate the toll that it has taken. We've kind of been in survival mode. And so now we are seeing, especially in the last 3 months, increase in psychiatric calls for mental health issues and for substance abuse issues. DEMIS has partnered with the United Way. 211 is a number that you can call. They will do a triage over the phone. You can call for yourself. You can call for your family members, your community members, your neighbors, to say, I don't feel right. Something's going on. They would then refer you to an organization like Intercommunity Healthcare, which is in Hartford, the north end of Hartford, and the greater East Hartford area. We can send out mobile crisis teams. We've been doing this for many, many years, but we now do it as a certified community behavioral health center, which is a federal designation that we have, and we're required to do 24/7 crisis mobile calls and mobiles into the community if that's necessary. So we do a triage on the phone. We talk to people. We then may go out there. A team goes out, a licensed clinical social worker on the mobile crisis team. You have nurses, peer supports, psychologists, all different kinds of professionals. And we may go out with the police. Sometimes the police ask us to come with them. Sometimes we ask the police to come with us. And we can really talk to people, hopefully kind of see what's going on for them, have them set up a plan, help them with what are the resources out there so that we can get them through the night, through the crisis, and then refer them to all and help them to get to all the resources they may need the next day.
Hey, thank you, Kim. Well said. And it's a real priority for us with our federal resources, $10 million a year to these amazing programs, just like Intercommunity at East Hartford. What a difference they're making. Other thing we just want to talk about a bit is some of these stress is reflected in violence. That can be shootings and the such. And we're making a significant investment there, not just in terms of police, not just in terms of community policing, but all those community groups that work alongside the police to do what we can to prevent violence before it can happen. And there I'd like to introduce two friends. First is Jackie Santiago. She's from Compass Peace Builders. They work with youth. They have the after-school programs. They have the community youth programs. They're doing everything they can to lower the temperature, reach out to kids, let them know they're not alone, and make sure we're there in a time of need before they take other avenues. Go ahead, Jackie.
Thank you, Governor, for the opportunity to be here today. I am Jackie Santiago. I'm with Compass Youth Collaborative, and our Compass Peace Builders are out in the community interrupting incidences of violence every day. While many things did slow down or stop, gun violence was not one of those things. There are shots fired in our neighborhoods on a daily basis. The number of non-fatal shootings has multiplied. And our peace builders are those mentors who have lived similar lives to the youth, who know the community and are out in the communities when a lot of us are sleeping, or even during the peak of COVID. They were out there interrupting incidences of violence amongst youth, meeting basic needs like food and sanitation items. But most importantly, we're responding with partners to the hospital during these times of violence in the community. And we are able to be a support to the youth and the families through the relationships that we have meticulously cultivated over the years. And we are able to mediate and interrupt incidences of violence and prevent that retaliation from happening as a result of a violent incident. We're working with partners throughout the community, including the police department, to make sure that our youth are safe and that they're able to navigate these obstacles and eventually connected to their education and workforce. So these are so important during times of violence, but we're also out there in times of peace, making sure that people understand that they have resources available to them. So we are providing that case management supports, referring them to mental health services and other things that they need to make sure that all of our communities are safe.
Yeah, thank you, Jackie. A lot of these young people have been alone for an awful long time, and the stress that means. That's why we're rolling out our summer camps. That's why I work with people like Jackie and Kim, doing everything we can in terms of outreach. One last person I'd like to introduce before taking your questions, Jeremy Stein, Connecticut Against Gun Violence. Sometimes all the best prevention doesn't work, especially if there's too easy access to a gun. Jeremy, what are you seeing?
Thank you, Governor. I want to thank you and your team for championing this issue and making gun violence a priority. As you're all probably familiar, recently in Hartford, 3-year-old Randall Jones was shot and killed while in his car with his siblings. Later that afternoon, just a mile away, 16-year-old Jamari Preston was shot dead. Janet Rice, our outreach coordinator, she knew the families, she attended the vigils, and she knows the pain because her own son Shane was murdered at age 20 in Hartford. Little did she know that her godson, Eddie Garcia, would be murdered later that evening in Hartford. This past Sunday, Shane would have been and should have been 29 years old. And these are not isolated events at all. Janet's story is not even that unique. The crisis of gun violence disproportionately affects communities of color. Young black men in Connecticut are 39 times more likely than young white men to be murdered with a gun. And in recent years, firearms are the leading cause of death among children and teens, and more than half of all black teens who died were killed by gun violence. And the COVID pandemic has only made this problem worse. So there is an urgent need to put more resources into community-based violence prevention efforts, as you've heard today, with gun homicides up 50% since last year, and we need intervention now. Places like Waterbury saw a 500% increase in gun violence. That's why Connecticut Against Gun Violence, in partnership with a very broad and growing coalition of organizations that propose the Connecticut Initiative to Prevent Community Gun Violence. The idea is to fund and support evidence-based, community-centric solutions to end gun violence. And we welcome the news just announced by Governor Lamont that proposes spending an additional $3 million over the next 2 years on community violence prevention programs funded by the Biden administration's American Rescue Plan. This is a great foundation on which to build towards the vision of the Connecticut Initiative. We're also very encouraged by members of our General Assembly, Senator Moore, Senator Abrams, Senator Winfield, Representative Nolan, Representative Stastrom, Representative Steinberg, and others who have identified this as a public health crisis. An informational hearing that was held last week with members from bipartisan committees seemed very committed to the idea of supporting community violence prevention strategies, as you've heard today, as well as the creation of an advisory council or commission or task force to help with this and make decisions about how best to reduce the daily shootings that happen throughout our state. Community-based organizations such as Compass and Hartford Communities That Care, Connecticut Violence Intervention Program in New Haven, also Street Safe in Bridgeport, they're doing an amazing job doing the dangerous on-the-ground work many times while we sleep. Programs like these need to be better funded, and we need more evidence-based programs working collaboratively in more of our urban areas around Connecticut, and we are proud to partner with these organizations. These strategies to invest in our community-based solutions to end gun violence have been very successful in other states like New York, New Jersey, California, Maryland, Massachusetts. They've all made commitments to invest in similar strategies, and we have, here in Connecticut, we've always been a leader on gun violence prevention, and we should lead once more again on this issue. So now is the time to act. We are very hopeful and grateful that this is a priority for both legislators and the governor alike, and we look forward to continuing the discussions that are underway and making sure that all of our communities are safe. And once again, we want to thank you, Governor, for your efforts in this matter.
Thank you, Jeremy, and Jackie and Kim are staying on if you have any questions, as are Paul and Josh.
News 8.
Hi, everyone. For Governor Josh, can you talk a little bit more about the grants and the communities that will be sharing in that $13 million and how they reached out to you and applied for this? What were some of the things that they had to show you in order to get chosen?
Why don't you take that, Josh?
Sure. Well, we press released, Governor press released earlier today the list of towns. I won't run through all of them, but it was really an open application process for any community that was looking for some extra support, as the governor said, to hire people to go door to door, to make phone calls, to train trusted messengers in the communities who can go out and talk to people who may still have reservations about getting vaccinated, support partnerships with churches and other community-based organizations to do vaccination clinics. So it's really just the ground game at this point of trying to provide all the resources to our local partners that we can to ensure that they are reaching out to the remaining people who have not yet been vaccinated.
Governor, is this effort another effort to have as many different opportunities and different ways that the underserved communities can get the help that they need or to reach out to them? Or is it a little bit showing that maybe some of the other things, the vans that go out and stuff, there hasn't been enough reaction, and this is another way to turn to help those people or to get those people to get vaccinated?
We're trying everything we can. As you saw that, the number of new people getting vaccinated is not going up as quickly as it was a few weeks ago. And we realize now we got to work a lot harder in underserved communities and young people. And everybody. And sometimes it's a matter of access, making it easier for you to get vaccinated. Sometimes it's a matter of outreach, and that's what this is all about, working with our local health departments, knocking on doors, trusted advocate, getting there. Who knows? We'll try. Then we've got some incentives we've talked about before, doing everything we can. If we can get up to 80% as opposed to 70%, what a difference that makes.
Channel 3 Eyewitness News.
Yes, Governor, a real quick question about unemployment, something that's kind of been brewing for a while, but really seems to be manifesting itself now is staffing issues. Employers are telling us they're having a hard time finding applicants because they say unemployment benefits are just too lucrative right now. Are you hearing the same types of stories? And if so, is there a solution there?
I have heard some of that, no question about it. There is still a relatively high unemployment rate. It should be a couple things to remember. One, the enhanced unemployment benefits end on, I think it's September. So now's the time, if you can get a good paying job, get it. Obviously we have great certificate programs out there, so if you want to change jobs, step up. And but it's really important, I'd say, for employers. I used to be an employer. Maybe you have to pay just a little bit more right now to get people back in the game. There's some hesitancy. Maybe I stay at home an extra couple of months given COVID. So I think there'll be a variety of solutions. We're going to get everybody back to work.
Got it. And my final question goes back to the violence and mental health issues that we're experiencing. Do you feel like it's going to subside now that the state is reopening further, or is this something that's just going to take longer to combat because we've been grappling with these issues for months now?
I don't know. Jackie, do you want to take that? Is this something you think is going to subside as COVID subsides, or is this too deep-seated?
Well, the reality is that violence was the first pandemic that we faced in our community. And COVID only highlighted the impact that we're feeling due to poverty, lack of policies and other things. But we don't see that this will end soon. It does need to take intentional work on all our behalves in order to make sure that this subsides over time. We're dealing with mental health issues. We're dealing with issues of poverty, desperation, all of these different things. So it's a multifaceted approach that needs to take place, and it needs to take place over time. The impact of this past year will take a while to address, but I think it's possible.
Thank you all.
NBC Connecticut.
Good afternoon, Governor. Matt Austin with NBC Connecticut. I heard you mention 80% in terms of the vaccination rate. Is that, does the state have a new goal in terms of what you would like to see and what you would think would qualify as herd immunity?
Look, herd immunity is not an on-off switch. 50% we found in Israel and a variety of other places makes an enormous difference, and we've hit 50%. I said 80% because I think we're very close to 70%, so let's keep upping the bar a little bit. I'm really proud of older folks who are well over 90% now. Who would have thunk that just 3 or 4 months ago, and we thought vaccine hesitancy was going to keep maybe half the people on the sidelines. So I keep raising the bar.
And in terms of Johnson & Johnson, it's been a little bit, about 10 days or so since that pause was lifted. Has the state seen an increase in people who are looking for that shot?
Do you know that, Josh?
Yes, there's been some demand for Johnson & Johnson. I think we've had a day where we've gotten up to about 900 people receive Johnson & Johnson vaccine. So it's been steady. There's plenty of Johnson & Johnson available. We're trying to pair clinics where we're offering one of the mRNA vaccines, bring Johnson & Johnson there as well. We know there's a lot of people who are still looking for Johnson & Johnson. We want to make it available to anyone who's searching for it.
Okay, thank you.
Fox 61.
Hello, Governor. This question is for you or for possibly Josh. We are learning that Pfizer is going for that emergency use for the vaccinations, that vaccine for ages 12 to 15. If that does come into play, are there any plans to set up clinics in Connecticut schools to get those children vaccinated?
Yeah, I'm not sure we're going to have them in time for this school year. If we did, I think it'd be a good idea with parental permission. We got to think about what we do in August and September, because I think it would be very helpful in building confidence to get kids back into school in the fall. Josh, anything to add?
Yeah, I think one of the things we've learned with regards to our program to vaccinate high school students 16 to 17 years old is we see by far the most demand for vaccines for our teenagers on the weekends. Probably not surprising. You need a parent to consent for you, and so it's probably easiest for both the child and the parent to align their calendars and be able to go get vaccinated on the weekend. So as soon as we get the green light from the FDA, we'll have our mass vaccination sites available and other clinics to vaccinate our 12 to 15-year-olds, and we can get that access set up as quickly as the FDA gives us the green light. There's about 177,000 children between the ages of 12 and 15 in the state of Connecticut. So, once that approval comes through, if we get a good chunk of that population, that'll move the overall state vaccination rates up a couple of percentage points.
Thank you. And Governor, any indication of how this first weekend went of relaxing restrictions on businesses?
My evidence is anecdotal, but I think people really appreciated the chance to be outside with a mask, as long as they were there with trusted friends, and maybe have a pop without having to have a meal. I think it was a good day for the restaurants and a lot of good fun for a lot of other folks.
Thank you.
WTIC 1080 News.
Hi, Governor. New York and New Jersey are joining Connecticut in easing the COVID restrictions on the same date as you, May 19th. It doesn't seem they're going as far as you did, eliminating all business restrictions. Was there any advice you gave them leading up to this?
Well, we just had some informal discussions over the last week or so. We said on May 1st, we're going to be outside. We're going to be outside without size restrictions at the tables and the such. I think they're following along pretty quickly. May 19th, you're right, though. We're ending those business restrictions with one exception, the indoor mask rule, and they'll be doing something the same, at least in terms of the indoor mask.
Does that come by executive order, or is the legislature moving this week to vote themselves to give you the power?
Well, I'll probably do an executive order. It's a continuation of the executive order for indoor masking. And of course, the legislature is welcome to step in anytime. If they think we're being too strict or not strict enough, they can take a look at any individual executive order and make a change. They're in session.
Connecticut Public Media.
With the Johnson & Johnson vaccine, there seems to be a lack of interest at some locations. It looks like in Greenwich, they had around 960 slots available, but only 25 were taken. Are those going to waste? What's happening with those unused Johnson & Johnson vaccines?
None of the inventory goes to waste for a while longer, but we are monitoring expiration dates on all the vaccine very carefully. All of our providers, have very clear instructions about how to do that. So nothing's at risk of going to waste anytime soon, and we continue to have, plenty of supply going forward as well.
And then with the mobile vaccination vans, are you now bringing back the J&J vaccine to those vans? I know for a while you replaced it with the other one, but are you switching up for the one dose?
Well, as I mentioned earlier, what we're trying to do is provide choice. So, where we're going to a large event or an area where we're anticipating a lot of foot traffic, we're trying to bring two vans, one that can provide Pfizer and Moderna, one that can provide Johnson & Johnson, so that people have options.
Thank you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, given the continued sporadic outbreaks that we're seeing in nursing homes, there have been some visitation shutdowns, and the families are pretty frustrated, and they really want legislation that allows an essential caregiver to go in there. And I know this is something that they have reached out to you about, and they wanted you to sign an executive order concerning this, and there is legislation pending. Where do you stand on this issue?
Josh, aren't we following federal guidance when, if there are flare-ups in a nursing home, we curtail visitation?
Yeah, that's right, Governor. We are following guidance from the Federal Centers for Medicare and Medicaid, which regulates this area. So that's correct. Fortunately, the flare-ups you're referencing, Sue, are very few and far between right now. There are very few cases in our nursing homes across the state, but I can imagine that, if you have a loved one in one of the homes that does have some cases, that could be very frustrating at this stage. So if there are particular issues that family members are concerned about, I recommend they report those to the State Department of Public Health.
Thanks for that. But Governor, do you think there should be an essential caregiver law in place that maybe if there was some sort of a shutdown, then at least one person could still get in there and help people with feeding? Some of these folks really have needed these people that they rely on, and they haven't been able to be there.
In my heart, I do, Sue. I got to tell you, if that essential caregiver is fully vaccinated, a chance to see a loved one who's been otherwise isolated in a nursing home makes an awful lot of sense to me. I will bring that up yet again with, not the CDC, but Jeff Zients and the COVID task force. We like to follow their guidance wherever we can.
Okay. And do we have an age range for the fatalities that we're seeing now? And are these usually people with comorbidities?
You have that, Josh?
I don't have the age range at hand. I mean, as you've seen, fortunately, there's very few deaths at this point, averaging 6 or 7 a day. We expect that to continue to go further downwards in the coming weeks as we've seen cases and hospitalizations decline. Yes, though generally, when we've analyzed this data in the past, it always tends to skew towards people who are older, people who have other risk factors. But more recently, it's overwhelmingly people who are unvaccinated. That's the main common thread at this point. The people who are hospitalized and people who pass away from COVID-19 is overwhelmingly it's people who are not vaccinated.
When you say overwhelmingly, like what percentage roughly?
Extremely high, upper 90s. I don't have the exact number, but nearly 100%.
And on a different note, Governor, given the recent racist symbols that we've seen in Connecticut, the noose at the Windsor Amazon building site and the swastikas at UConn, do you think Connecticut needs some sort of special focus on this? I know that there was a bill at one point to have a special unit within the state police. Is that anything you'd support?
I think we always need a special focus, Sue. Whether it's a special unit at the state police, I can't tell you. But it was a little less than a year ago that we had a lot of the demonstrations following the murder of George Floyd, and it was state of Connecticut, black, white, otherwise, all marching, sometimes arm in arm, and they took a knee because they were outraged by what they saw. And I hate to hear these stories now, 11 months later, that you have some of these racist symbols, and be it one or two of these distribution facilities or one of our colleges. I think it's really a matter of friends speaking to friends and saying, this is outrageous, this is not America, this is not who we are.
Okay, thanks so much.
The Connecticut Mirror.
Good afternoon. When it comes to the calculation of 50% of Connecticut, of people, I guess 18 and older, is that the standard? Was it 16? Okay, 18. Most of the national tracking lists have had Connecticut high, but it's been a 40% number, which I assume it's because they're using total population, not the 18 and above. But can you just very quickly tell us who calculated that and how that was done, that you could be certain that Connecticut is first in the country as far as being 50% of all the 18 and above?
Welcome back, Paz. You take it, Josh.
As that is straight off the CDC website. I'll send you the link.
All right, because most of the stuff I saw, it was total population. All right, but
it's 40 as of right this minute. CDC has us at 40.3% of the total population fully vaccinated and 50.3% of the 18 plus population. Those are the cuts of the data that they do, and in both of those categories, Connecticut's currently ranked first in the nation.
Okay, thank you. When it comes to the vaccine equity grants that were announced today, how much of that is now focused on overcoming hesitancy of educating folks as opposed to making sure the access is there?
I think it's a matter of reminding people how important it is, Paz. I mean, I know there's some hesitancy, but I'm not sure it's a conscious decision. I don't want to go get vaccinated. You know, what I'm hearing on the lines as I, greet people after the outreach, took a phone call from a friend saying, come on down, it's available right next door, I'll go down with you. So it's a mix there. I think right now people are getting a little bit casual, especially younger people are getting casual, which is why it could take a bit of peer pressure to get people there.
Okay, but at what point do you think the state or the U.S. for that sake is going to need a more sophisticated approach? That there are different population groups here that have different concerns. You had people who were concerned about safety. You had younger people who seem to think, they're not at risk and they don't fully understand how them being vaccinated is important to halting or slowing community transmission. So where do you think Connecticut is as far as needing to come up with a plan that's a little bit more sophisticated than just having trusted people in their worlds talk to them?
Well, I'll start, but then I'd love anybody else to speak up. I'm not sure a really sophisticated, targeted marketing campaign is necessarily what it takes to get a 23-year-old out of bed and down to the vaccination site, and that's often, the target market, so to speak, of the people we need. I think it is folks that they trust, folks that they admire, that give them that added impetus to do it, or often a friend. So that's why we're doing that door-to-door community outreach. But I just sort of made that up. Anybody else have a better idea?
I think that's right, Governor. I mean, there has been a significant amount of research that's getting done by the federal government and other groups on the national level, looking at motivations or reasons that some different populations have decided not to get vaccinated, different messages that may resonate, different messengers that could be helpful. And we are looking at some of that, replicating some of that same research in Connecticut, as well as looking at different approaches that we can use to do more micro-targeting in certain communities, understanding which street blocks, which neighborhoods may have lower vaccination rates, that we could bring additional access to, as the governor pointed out, to make it as easy as possible for people to get vaccinated if they haven't done so yet. So there is a lot of work going on in this general area, Paz, because we agree, that in addition to everything the governor said around access and kind of making that as easy as possible, we're going to continue to push the envelope on what more we can do as a state to keep these numbers going upwards.
But you have data in Connecticut that, correction officers, it was a very low percentage. The New York Times had a story today nationally looking at police officers. So again, these are very different, cohorts. You got kids, you got racial minorities, you got cops. So again, I guess I'll leave it at there. That I guess you've answered it as best you can at this point, and I appreciate the governor's honesty in admitting he just made that one up.
CT News Junkie.
Thanks, Max. Governor, I think you touched on this earlier, but so I apologize to the extent that this overlaps. But do you anticipate your emergency powers going on beyond the May 20th date, and to what extent do you think they will?
Well, to a large degree, that's really at the discretion of the legislature. And Paul has had exhaustive conversations with the leadership on both sides of the aisle, as has Nora Dennehy. She has gone through all of the different EOs, narrowing them down to just the ones from a public health point of view that really have to be continued after May 20th. And at that point, leading up to May 20th, it's really up to the legislature to reinforce the emergency authorization, continue this for a little bit longer. Maybe they want to mix and match some of the different EOs. It's up to them, but there is a real need to continue many of them for even the foreseeable future. But Paul, do you want to add to that?
No, I think you just hit it right there, Governor. As the governor stated, our general counsel, Nora Danahy, has been working with the councils of the legislature, as well as myself working with my counterparts in the legislature. As the governor has stated, he stated to legislative leaders on both sides of the aisle that there's going to be a need to be able to continue these emergency orders. But first and foremost, as the governor said, the legislature's in session. They need to opine as well as it deals with the various emergency orders. The last time on April 20th, we greatly cut down the amount of emergency orders that were in place. And as we get to the 19th, we'll do the same. But at the same time, there are critical emergency orders that are needed for our vaccines distribution, our testing distribution, our outreach plan, go on and on and on, and just the overall ability to serve the people of Connecticut. So we look forward to getting some final clarity from the legislature, but we've been working with them very closely to let them know what are the important aspects to the governor and to the administration.
Thanks. And I know this may be tough to sort of nail down, but is there any time in the future where you can, from here, envision that we won't need this anymore, as far as you guys are concerned?
I'm not going to go there. I mean, my sense is, Hugh, that there are going to be booster shots, there's going to be youth vaccinations, there are going to be flare-ups, some in India, some in Brazil. I know from 1918 that it took another few years in terms of flare-ups in different parts of the country. There were no vaccinations back then, by the way. But it did not just, you don't just turn out the light and that's the end of COVID. So I think we've got to be very careful and also very agile and make sure we're able to respond as circumstances change.
Okay, thank you.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. So first question, I wanted to ask about herd immunity. I know that you were talking about this a bit earlier, but what do you think are the chances that Connecticut actually can reach, a herd immunity percentage?
Well, I'll start, and then anybody. But again, it's not an on-off. It's not like, finally we're at herd immunity and we've stopped COVID dead in its tracks. 50% fully vaccinated makes an enormous difference, Emily. 80% makes an even bigger difference going forward. Then we have to worry about the variants. If something happens in Brazil and India where there's an awful lot of infections and an awful lot of room for new variants, the herd immunity could be compromised. So all I know is the more people who are vaccinated, the safer we are. But anybody else want to add to that?
No, I think that's perfectly summarized, Governor.
Definitely, I definitely understand that the closer we get to full vaccination, the safer everybody will be. But with that kind of herd immunity threshold, do you think that it's possible to reach that? I know that public health experts have said that that's the difference between actually eradicating a virus and kind of moving into this containment mode.
Well,
I think we've heard, some leading public health experts, including, Scott Gottlieb, former FDA commissioner, who's been a regular on this press conference, suggest that it's unlikely that the nation or the world will, get to complete herd immunity, and that there won't still be some COVID out there because, we're not in a position as a nation or a world where there's a plan to mandate vaccination for everyone out there, and therefore there will be pockets of people who choose not to get vaccinated, and those pockets will provide opportunity for COVID to continue to lurk. So that's likely the mode that we're going to be in for some time. And therefore, this is why we're still so focused on trying to get everyone vaccinated that we can, despite the fact that the cases and the test positivity and the hospitalizations are all declining so rapidly. And, last year's experience suggests that the summer should be a period in Connecticut, at least, of extremely low transmission, even at the vaccination rates we're at currently. But, we're thinking ahead, we're thinking to the fall. And so we want to stay focused on getting everyone vaccinated.
And with that, the unlikelihood of reaching herd immunity, how does that kind of change the policy approaches or the state's response? How is the state's response going to be different given that we are unlikely to reach herd immunity versus if we had been able to reach herd immunity?
I I think you're asking questions, Emily, that are pretty hypothetical at this point in terms of, how things play out in the coming months, not just in Connecticut, but around the country and around the world. What we do know is we're going to continue to keep very close eye on COVID, regardless of what vaccination rates we ultimately get to. And, I'm sure the governor will be prepared to take whatever action is needed in the future if necessary.
All right, thank you for that. And one last unrelated question. I know that health or vaccine providers in Connecticut have talked about in the coming days and weeks that they'll be scaling down the hours at the mass vaccination sites. I was wondering if somebody might be able to give me an update on the Rentschler Field site and whether there's any plan to scale back hours there or to close the site in the coming days or weeks.
No plans to close it at this point. I think they've already, cut back on some of the lanes of traffic based on demand, but no plans to close the Pratt & Whitney runway at this stage.
Do you see that in the near future as demand starts to wane a bit?
Yeah, eventually, the mass vaccination sites won't have sufficient demand to make it, make sense to continue operating all of them at least. I'm hopeful that we can keep most of them going until we get adolescents approved. That 12 to 15-year-old group will come in with some bigger numbers once that's approved. It'll be based on demand, and what we'll see over the summer is really more of the smaller scale efforts, the mobile units and the community vaccination clinics.
All right. Thank you, everyone. Appreciate it.
Hearst, Connecticut Media.
Governor, you mentioned earlier that calls to 211 have spiked. Do you have any context for sort of how big of a spike, and can you provide a little detail on, the reasons for these calls? Are these people seeking substance abuse programs, mental health resources, suicide prevention?
Kim Beauregard, would you like to take that?
Sure, and it's all of those things. Again, I don't know what the exact reason is, thinking that people are kind of settling in a little more, thinking we're coming to the end of the road soon. And I think people are starting to realize the trauma and the effect that it's had on their lives, that they've been drinking more, that they've been using drugs more. They don't have to be sitting there with their child every minute or with their parents or whatever it is. And they're starting to take a look, I think, at how they're feeling and what's going on for them. So I think those are some of the reasons that the calls have exacerbated, and I think will continue to do so. I think, in some ways, that's a very good thing. People are asking for help, and we hope that that continues. That's what we're all about, is we want to, destigmatize and not discriminate against anyone, especially people with mental health and substance abuse disorders. And we want to let people know that there is hope, there is recovery, there is health and healing out there for everyone. And, there's lots of resources that we can help direct people to. Then they need to reach out and call and ask for the help.
And are we seeing large numbers of people who have never reached out or accessed mental health services now choosing to do so?
I don't know numbers on that, but I believe that is true. From what we've heard anecdotally, what I've read in some studies, that it is. People are feeling like, it's now they can say it's, I don't just have a substance abuse problem, but I have a substance abuse problem because I've been home for 14 months, or, my kids have been, I've been working with my kids and I'm exhausted. And so I think COVID gives a little cover. I don't know if people consciously think that way, but I think subconsciously, it's like we've all been through COVID. There's no shame or blame in it, right? We've all been through this experience. And now people can reach out, and we reach out as much as we can through different events and social media and those kinds of things to let people know that it is okay. There's other people out there struggling with the same feelings and thoughts, and there's help for you out there.
And Governor, the $20 million you mentioned earlier over 2 years, can you describe a little bit more in detail where that's going and who you envision being the recipients? A lot of, obviously, the nonprofits in the state are doing or providing a lot of the mental health services.
Yeah, Julia, I think you answered your own question, but we're going to be working really with all the not-for-profits, giving them the additional resources they need so they can respond to those calls on 211. They can respond to all the references that are coming in right now. And we can get the mobile vans out to people in need. We're finding increasingly you just can't do everything by phone. You can't do everything, via the internet either. It often requires a face-to-face contact, and these are all the efforts we're going to make with these resources.
And then lastly, related to the gun violence prevention funding, do you see this being an area that the state supports on its own ultimately over the long term, or sort of steps up without this federal funding, or when the federal funding goes away?
I think a little bit of all. I mean, right now, the federal government is giving a lot of resources to all the states. States are working with not-for-profits, local communities, and the such, experimenting with a lot of extraordinary programs that if they make a difference, the feds or the state are going to keep them going. If they don't make a difference, they won't.
The Day of New London.
Hi, everyone. Governor, I'm not sure how closely you're monitoring this, but have you noticed a lot of restaurants and entertainment venues pushing back their hours since Saturday? And have you seen some reticence to do that?
That's a good question. I can't speak to that. I wasn't there between 11 and 12. I do know that the restaurants really thought that getting from 11 to 12 was important so they could get a second seating. They said we're going to be very strict about patrolling what's going on there. So I might tend to think that there was a fair amount of demand out there and those hours were extended.
Thanks.
The Waterbury Republican American.
Well, thanks very much. Just wanted to follow up a couple real quick things. Governor, earlier on when you were talking about COVID vaccinations for school kids, you said, I think it would be a good idea to do with parental permission. So, this came up a lot during last week's rally ahead of the Senate vote to repeal the religious exemption. Many people there felt that it was only a matter of time before COVID-19 vaccines would be a required school immunization. What do you have to say to folks who have that concern?
I'd say come on in, give your child the permission if and when we get that full FDA approval. Let's get 100% of the people vaccinated voluntarily. That's where we want to be.
So you're not at this point contemplating any kind of requirement for school children to be vaccinated as a condition of attending public school or private school here in Connecticut?
That's right, Paul.
Okay, thanks. And also wanted to follow up quickly on Sue's question about the nursing homes. I also received some contact from some people, and one reader in particular can't see her husband. He's bedridden. They suspended visits because a staff member had tested positive. Now they're saying that the only compassionate visits are being allowed. And this person was questioning, they were told there'd be a $15,000 fine if this nursing home violated that rule, if they let someone like her visit her husband. She thinks that's sort of maybe not correct.
Josh, can you speak to that?
Like I mentioned, Paul, I mean, I think if you could refer that individual to our State Department of Public Health, they can look into the specific circumstances and see if things are being handled appropriately.
Okay. And can we get, is there any kind of update you can provide about what is happening with the Homebound and their caregivers? Obviously, the Department of Public Health has put that that form available online for people who are physically or medically unable to leave their homes. So just wondering, do we have any numbers on how many people have been vaccinated? How many homebound? Is demand, what's the demand like?
Yeah, my understanding is demand is pretty brisk for homebound vaccinations. It's another category, actually, we forgot to mention earlier that the $13 million of support for local vaccination efforts is helping to support homebound vaccination programs. And so if you are homebound and you need someone to come to provide vaccine, there's a link on the website where you can submit a form, or just reach out to your local health department or your healthcare provider, and they can help connect you. There's plenty of opportunities around the state right now to be vaccinated if you're homebound.
Okay, and that's handled on a local level, right? I mean, you fill out the DPH form, and then the local health department or health district will get in contact with you.
Correct, and it's routed to a provider in that community who's participating in that program.
Okay, thanks very much. And Josh, could you give us an idea of what the, at least I guess, the state order for vaccines will be this week?
Yes, I can go find it. It's been drifting downwards, as I mentioned previously. You know, we are, for the second week in a row, we will not order our full allocation. We don't have demand for it at this point, and we don't believe in, ordering vaccine that we don't anticipate being able to use in the next 7 days. So, we're ordering to the demand that we're hearing from our providers. And the good news for the country is that, we're well past the point now where anyone who wants a vaccine has plenty of opportunity to get it.
Okay. All right. And I guess, Governor, I'll maybe take a crack at Hugh's question, because I got another reader question. This gentleman says he's going to leave Connecticut if he has to wear a mask all the way through the winter. So is there any, can you be maybe even general, summer, fall, winter, when might this mandate disappear so this gentleman can make a decision about where he wants to live?
Well, since we just hit May and he's asking about all the way through next winter, I've got plenty of time. But look, my instinct, Paul, is within a couple of months, I'd like to think that our infection rate is very low, our vaccination rate continues to tick up, and the mask won't be necessary any longer. But let's make sure we can deliver the goods first.
Okay, thanks very much. That's it for me.
And Paul, we're ordering 158,000 doses this week. For next week.
All right, I'm getting the signal here. First of all, to Kim and Jeremy and Jackie, thank you. Maybe winning the war physically when it comes to COVID, we still have a lot of healing to do, and that keeps people safe, and your work keeps our communities safe. There are some questions today about, mandates and the such, and as you know, we're really focused on incentives, doing everything we can to incent people to do the right thing. First of all, because you keep yourself alive and you keep people you come in contact with alive. I was sort of amused reading about other incentives that are out there. I'm a bit of a baseball fan. I noticed that a number of the teams have said masks no longer have to be worn in the dugout if you've all been vaccinated. All right, there's a perk. And also, when you're on the bus or the plane to the next game, you can start playing cards with each other, but only if you've been vaccinated, because you don't have to be 3 feet apart. I thought that was interesting. Along the way, we were watching 60 Minutes last night, and Leslie Stahl had some other incentives she wanted to showcase.
The COVID vaccination rollout has begun to slow down. Some states are now offering incentives for people to roll up their sleeves. West Virginia's Governor Jim Justice, like Great Aunt Martha at graduation time, is offering $100 savings bonds for young people. Connecticut's Ned Lamont has enlisted restaurants to offer a free drink to the newly vaccinated. Good for the governors if it works. But it gives one pause to think people avoid a shot that could save their lives until offered a free margarita with Moderna, a Jim Fizz with Pfizer, or a shot of J&B to chase J&J. Then they get the point. I'm Leslie Stahl. We'll be back next week with another.
All right, that's a little self-serving, but you don't want to be the only one paying for the J&B when everybody else gets it because they've been vaccinated. Take care, everybody.
Thank you, Governor.